Good morning to everybody. Ellen Ayurvedic PG Entrance Coaching Center, Salvinagar, Hyderabad. Today's topic is important classical drugs in digestive diseases having multifold actions in different systems. This is the specialty here. Important digestive system, important drugs in digestive system having different multifold specific actions even in different systems. Let us see what are they. What are the drugs generally? And second point, in what way in PG examination they will be asking. The previous class I have told you very clearly. They may ask the Dasemani group in which how many drugs are there, in which group is missing, in which group which drug is missing, or in Dasemani the following are the some of the drugs, like that the version may come. So according to examiner's view the question may be there. But anyhow, see now as our organization is importing Ayurveda in or with multifold concepts. Today, let us see the classical clinical importance, how these drugs are applicable in different diseases. Let us see now. Number one, the title is Deepaniya Dasemani. Generally, the word Deepana itself indicates the role in digestive system. It's very clear. Let us see what are the drugs prescribed by charaka. Pippali, Pippalimula, Chavya, Chitraka, Pippali, Pippalimula, Chavya, Chitraka, Srungavera, Amlavetasa, Srungavera, Amlavetasa, Srungavera, Amlavetasa, Maricha, Ajamoda. Srungavera, Amlavetasa, Maricha, ಅಜಮೋದ ಬಲ್ಲಾತಕ ಹಿಂಗು ನಿರ್ಯಾಸ ಬಲ್ಲಾತಕ ಹಿಂಗು ನಿರ್ಯಾಸ. I will repeat once again. Pippali, Pippalimula, Chavya, Chitraka, Nagara, Amlavetasa, Maricha, Ajamoda, Bhallataka, Hingu Niryasa. Among them, what are the easily available drugs? You consider Hingu Niryasa? Number one. Number two, Ajamoda, Maricha, Amlavetasa, Srungavera. What is Srungavera? Nagara, Sunti, Srungavera, Chitraka, easily available. Chavya, Pippali, Pippalimula. These are easily available drugs. Generally, these dravyas with Katatiktarasa, Katavipaka, Ushnaviryas. But some of the dravyas in this group are with Katarasa, Katavipaka, Ushnavirya. See, the ultimate concept of Ayurveda is that introducing the Panchamahabhutas in this nature into the body. When these Panchamahabhutas are excessive in the body, definitely it is nothing but disease. When this is Ayurveda, this is a natural principle, try to understand. When these Panchamahabhutas are excessive, it is nothing but disease. When the Panchamahabhutas are having deficiency in the cell, system, tissue, body, whatever you say, then also disease. But third concept, when these are in a balanced concept, it is nothing but the health that you cannot count with money. But by counting money today, we are purchasing the health. Am I right or not? We are trying to keep up in the sense. But how far it is possible? See, as long as the body supports, then only, as long as the body, so long you will have the response. If the body is not supporting, you will not get response. See, blindly we will blame the system, blindly we will blame the doctors, blindly we will blame the hospital. You have to understand. See, doctor will explain. See, negligence is different. See, when a drug is given properly, having proper indication, when introduced into the system, how the degree of activity, whatever you say, pharmacological activity, depends upon the degree of the pathology, whatever you are calling doshas or the doshas and dhatus and malas. Doshas, dhatus and malas. So we have to analyze this point. Without analyzing, we will be misguided by different or in different angles. Let us see now, these drugs are very, very important. You can use these drugs in digestive disorders, but try to understand these all these drugs useful not only in case of a digestive system, but also useful in case of respiratory system also. Respiratory system also. See, people you take one of the best bio enhancer, whatever maybe the treatment, whatever drug, if you are adding this pipali, it will act as a bio enhancer, it will activate the activity of the other drugs also. See, starting from the cold and cough, eosinophilia, asthma, bronchitis, pneumonia, in all these conditions, you can have the root level treatment from these drugs. But here I am stressing as digestive agents or digestive stimulants. See, when my title is digestive system today, but I am going to the respiratory system. So this is the beauty of Ayurveda. Here what happens, from starting from the formation level in the system, you can have the check. So that is why it is root level treatment. You got it, mind? That is why it is root level treatment. What for we are using Ayurveda or what for we are using naturopathy? I mean, in a natural way, why we are fighting? Because from the root level itself, if you want to get rid of the problem, not to have the reoccurrence of the complications, or see, nothing wrong in having the subject to symptom relief, but total relief if you want to get, you have to use the root level treatment. So now we have completed digestion, Deepari Dasyamani. Next we are going to see Balya Dasyamani. To promote the strength, what is Balam? Yet Dravyam Balaya Hitam Tad Balyam. Yet Dravyam Balaya Hitam Tad Balyam. That promote the strength. What is strength? Which system strength? All the systems require strength, is it not? General doctor will say, your system, you are very weak. What do you mean by weak? The tissues in the system, today your language is the proteins, fats, carbohydrates, vitamins, enzymes, nutrients, nutraceuticals. Is it not? It is our more. See, as the system, what the society changing, science may change sometimes. So the technical terms may change, but the concept never changes. Our intention to maintain the health, See, that means starting from, whatever may be the disease in this universe, it is from digestive system. If I are able to saturate the digestive system, all the systems will be saturated. But generally, today, in a speed jet, these are the jet days, is it not? These are the jet days. We are giving importance to the symptomatic relief. See how the symptom, from where it is, what it is, how far it is, it can stand in the sense whether having the reoccurrence capacity or not, like in cancer and other related aspects. In such conditions, how we have to go for the root level treatment. See, we are thinking the duration only. You take any science, it is a question to the universe, not to you personally. Suppose you are using a medicine for 1 month by paying consultation. After next month, you have to stop the medicine. Am I right or not? Why we are not stopping the medicine? In any system. What does it mean by treatment? What do you mean by cure? What do you mean by prevention? Prevention is not to have again. Treatment means timing only. Maybe homeopathy, maybe Ayurveda, maybe allopathy, maybe Unani, maybe Siddha. In other countries may say herbal medicine. It is a timing only. See, as long as the mechanism is going on, so long the input and output will be there. Am I right or not? As long as the input and output is there in the system, so long what happens? The balance may be there or the imbalance of the chemical compounds may be there. Today, what are you observing in your microscope? In your microscope today, you are observing the contents, whatever you say, the chemical contents you are observing because of deficiency of calcium, excessive calcium, more sulfur, more phosphorus is it, and more creatine, more urea, more uric acid. This much only. Entire universe is a big lab. Every lab now crores turnover is going on to find out such things in this universe. Am I right or not? But we are saying as doshas, vata dosha, pitta dosha, kapha dosha. See, mainly it is because of the samanavata, apanavata, mainly because of samanavata, apatavata, pachika pitta and prachika pitta. 4 words I am telling. With these 4 words, with the deficiency, with the excessive status related to it's their biological activity, that diseases today what we are getting. What we are getting, the whatever disease today, you are getting mainly because of this point only. So if you are able to balance this method, no disease will be there. You can prevent the diseases. Control the diet. Nitra aharam brahmacharya. You have to control the diet. It is true. And you have to maintain the sound sleep. It is true. Naturally, you are supposed to get the sleep. And brahmacharya, as per the required life. In different angles, different language will be there. Is it not? So as per the requirement, using our body is real health. Okay, so what is happening in digestive disorders? Generally, dravya katu rasa or katu rasa, katu vipaka, ushnavirya. These can be used in other nervous system diseases also. Other nervous system diseases also. Now let us see next. What I mean to say, Balidasam is going in, and what are the drugs? Aindri, citrus colors in this. It is a easily available drug. In Balya Dravyas, it is easily available. The citrus colors in this. It is the best digestive agent. Basically, its Rasavari Vipaka is a Katatikta Rasa, Katu Vipaka, Ushnavirya. But how it is going to act as a Balya Dravya? Because my version I am saying, from root level it gives treatment, it helps or it plays a major role in transformation of the tissue elements, whatever you say. Today, different systems, I will call them as rasa, rakta, mamsa, medo, marja, asti, sukra. Is it not? So generally, people in the those who are having taste in Ayurveda, if really they are analyzing the chemistry of this Ayurvedic drug, it is having Katarasa, Katavipaka, Ushnavirya, having the Ajikita, Agni Mahabhuta and Vayu Mahabhuta. Is it not? Then what is the role of the Agni Mahabhuta and Vayu Mahabhuta without Prithvi Mahabhuta and Jal Mahabhuta? Without Prithvi Mahabhuta and Jal Mahabhuta, the role of Agni and Vayu will be there to initiate the work, to maintain the work, to support the work and to spread the work. This is the purpose of your Agni Mahabhuta and Vayu Mahabhuta. So anyhow, we need not go interior aspects. Let us see next one, Aindri and Rushavi. What are the other drugs? Let us see to promote the strength, irrelevant of the sex, irrelevant of the age, to the strength is required. Is it not? Who is not willing to have this strength? You tell me. Everybody requires strength. Everybody requires strength. Is it not? Let us see drugs. Aindri, Rushavi, and then Atirasa, Rushya Prokta, Atirasa, Rushya Prokta, Aindri, Rushya Prokta, Payasya means Hypomia paniculata. Payasya means Hypomia paniculata. Rushya Prokta means Taraminus labialis. Rushya Prokta, Taraminus labialis. For important drugs, I am giving little analysis also. Then Ashwagandha, Stira, Desmodium gangeticum, Ashwagandha, Stira, Desmodium gangeticum, Rohini, Picrorhiza curro, Rohini or Katagrohini, Picrorhiza curro, Bala, Bala and Atibala. Bala and Atibala. Now, I have told you 2 groups. Is it not 2 groups? Anyone is prone for bit formation or in interviews or in bit formation like M.pharmacy Ayurveda Vidyapit, Rashtriya Ayurveda Vidyapit, M.pharmacy Ayurveda, MD MS examinations, practical aspects is and Viva aspects. These are very, very important. In this today's class is a very, very important class, having clinical importance also. Let us see next group. Varniya Dasemani, that improve the complexion of the body. Can we change the color? We cannot. We can change the quality of the color. What do you mean change the quality of the color? we can maintain the quality of the blood. Three questions are there, three answers are there. See, by applying the tons of creams, you cannot change the color. Am I right or not? But by taking certain quantity of the natural powders, or in case of emergency treatment, whatever you follow, you can maintain the quality of the blood. You can maintain the quality of the blood, and you can prevent the diseases rooted out because of the impurities in the blood. Like you take simple pimples. In trend, we are applying so many creams, is it not? But no use. You have to change the blood in the system. If you are able to change the blood in the, what do you mean changing? Quality changing. We are not touching the body. How the system is, you need not touch the patient's body. Am I right? Simply give the blood purifiers in the system of Ayurveda. See the result in future. The system is detoxified. Previously detoxified. After giving these drugs, the system will detoxify. Today you are giving antifungal drugs, antiviral drugs, or antibiotics in different types of names are there. All these are related to the blood only. See, in Ayurveda, in the system of Ayurveda, how we are calling in the sense, they are Kandugana Dravyas, Kushtakana Dravyas, Prana Sojana Dravyas, Prana Ropana Dravyas. I will repeat once again. Kandugana Dravyas, Kushtakana Dravyas, Prana Sojana Dravyas, Prana Ropana Dravyas. Apart from that, other important drugs are there. So this, even Rakta Shodhaka Dravyas, in general, we are calling Rakta Shodhaka Dravyas. Is it not? This Rakta Shodhana, see, Susruta treated Rakta as one of the dosha. Vagbata, other people, Charaka mentioned Vata, Pitta, Kapha only. See, Vata, Pitta, Kapha. Whatever the differences here, Rakta Sodana Dravya generally we have to use. See, what I mean to say, Rakta Sodana Dravyas wherever, whenever an infection is there. No, not only, it is not the concept. In general, Rakta Sodana Dravyas can be given for preventive purpose, for curative purpose, or even to maintain, even to maintenance this healthy condition. We can use all these Dravyas. Just I will go through once what are they. Chandana, Tunga, Kalophyllum, Inophyllum, and Padmaka, Usira, Madhuka, Manjishta, Sariva, Payasya, Sita, a variety of Dhurva Sita, and then Lata. Sita is a white variety of Dhurva. And Lata, it is a black variety of Dhurva. Sinodon black variety. Okay, now see, these dravyas can be used starting from the simple pimple to the complex cancer conditions. Try to understand. I am repeating once again. These dravyas can be used simple pimple to complex disease. In Ayurveda, your pimple is called as a Yavana Pitika. See, these are common. But how to prevent these? It's an excellent drugs in the system of Ayurveda. See, apply the creams, nothing wrong in that. But try to purify the blood. You are at a young age, these are common. In disease condition after 30s and 40s also, these may occur. There are chances. But try to understand, purify the blood, starting from the root level, see the result. If you are observing the result, so that is why people will, when a patient is approaching the doctor, they will see the time, column. They will count the days, they will count the hours. In threat conditions, you have to count the hours. In chronic diseases, you have to spare much more time. So blindly, don't believe on the time. What I mean to say, it requires more time. Round the clock, if you are watching the wall clock, your disease will not come down. You have to use the medicine till the breath. How long means? As long as the system is going on, so long you are supposed to use. You take any drug in case of diabetes or in case of arthritis, for example, two chronic problems. You stop the whatever drug, for example, you take the metformin, you are taking 1 month, then stop the medicine, next month see the result, make the call. That means how long? That question is not applicable here. What I meant to say, that question is not applicable. You have to use it. Every system, if you are stopping the metformin, your levels are increasing, your sweet content levels are increasing in the body. Am I right or not? So what do you mean by treatment? So you have paid the consultation, 30 days is over, again the treatment is over. What do you mean to say? You mean to same? You mean I mean same? No, it is not same. You have to continue treatment also. So blindly, how long we have to use? How long? That depends upon the factors in the body, that depends upon the degree of the pathology in the body. How long, if you want to get the answer for how long, change the diet. If you are able to change the diet, you will get the answer for how long. See, practically you take one disease, you take the diabetes, control the lifestyle, change the diet, specific drugs, food style is mentioned in the system of Ayurveda. Then you go for the reading. You are taking a chemical compound and going for the reading, or you are taking a drug in Ayurveda, going for reading. Nothing wrong in that. But prior to that, you change the lifestyle, change the food style, go for the reading. But are we doing like that? No, we never do like that. We are taking a chemical compound, or we are taking a drug in any system, then we are going for the reading. What I am suggesting, what I am insisting, what I am requesting, so the society depend on the diet, go for the investigation. See, what I have told you, entire Panchamahabhutas, when they are in excessive disease, when they are in low deficiency disease, when they are in balanced condition, that is disease. Today, whatever food style, whatever food you are getting is nothing but an herb. Am I right or not? Your body grown because of your herb only. So that because of that herb, that disease is arised. What I mean to say, ahara. So additional contents removed from the body. See, that is why what a cells keeps properly is called as health. Excessively keeping is disease. Not keeping also disease. So you have to understand what is there in the body, what has to be removed, when has to be removed, whether to be removed or not. Without analyzing this point, when we are going for the symptomatic relief, what happens? Superficial cleaning. Nothing wrong in that. It is mandatory sometimes. But after cleaning, what happens, again you have to go for the body physiology functions, understanding, body pathology function, body degree of the pathology you have to understand. Without understanding these points, today we are depending on different commercial aspects. What I mean to say, we cannot get the result if you are not following the fundamentals based on the Prithvi, Ap, Tejo, Vayu, Akash, Mahabhutas. Of course, these are the concepts in the system of Ayurveda. Today we have covered excellent Varnya Dravyas. These Varnya Dravyas apply, and don't see the color. I am not giving guarantee and warranty to you. If anybody comes to my clinic, I will give a cup of tea only. No guarantee, no warranty. See, even court is saying like that. Why I am speaking such things? I would like to create a degree of awareness in society. In what way we have to move with hospitals, we have to move with doctor, in which extent or up to which extent a doctor can take responsibility depends on so many factors. Okay, today you apply the Varnya Dravyas. These are very, very important. It improves your, if I am using the word beauty, you will be attracted. But I will not use such a word. I will use these Varnya Dravyas will promote the quality of the blood. See, the quality of the blood improves the beauty. What is the beauty? Maintaining the body shape. What is body shape? Depends upon your proteins, fats, carbohydrates. In Ayurveda, natural Vata, Pitta and Kapha. See, the terminology may differ, the concept is one and same. The terminology may differ, the concept one and same. But the time taken for drug action may be different. That depends on so many factors. Without knowing this will take time, and a lot of time. We have to use many days. We have to use. This concept is wrong. Understand the concept first. Then you can have the see, you need not give the compliment. Don't have the comment. You need not give the complement. Try to understand, not to have the complement from both sides. Okay, today's class is over. So important drugs, what I have told you, Manji, in Varnya Travyas, your Manjishtam, which is easily available, Sariba easily available, and Durva also very easily available. You can use. Okay, use, and these drugs, in case of any doubt, just you contact 9014141722, Professor Simhadri. You got the number. Illinois Ayurvedic Speech Entrance Coaching Center, Savinakar. See, our dispensary running classically with with the classical natural drugs only, or in combinations. Nothing wrong in using, but our important to promote the concept of charaka, our important to rise the concept, the versions of charaka in today's era. Thank you.